Aortic aneurysm is a medical condition in which the patient's aorta swells and forms a bulge near the chest or abdominal region. The aorta is the largest artery in our body, responsible for carrying blood from the heart and supplying it to the entire body. However, if a bulge forms in the aorta, the chances of aortic dissection or rupture increase. If the aorta ruptures, it can cause blood to leak into the body, which requires immediate treatment. Otherwise, it can be life-threatening. Now let's see how and why aortic aneurysm occurs and how it is treated. The aorta is the largest artery that originates from the heart, taking a U-turn shape in the thoracic region and descending towards the lower abdomen. This artery further divides into smaller arteries to supply blood to the entire body. The wall of the aorta consists of 3 layers. The innermost layer is called intima, followed by the media layer, composed of smooth muscle cells, and then the outermost layer called externa or adventitia. The external layer is surrounded by connective tissues that provide additional protection to the aorta. However, sometimes certain factors can weaken the aortic wall, causing blood to enter from the intima layer to the media layer, leading to the swelling of the aorta. When blood accumulates between the intima and media layers, this condition is called aortic dissection. In this condition, if the bulge becomes larger, the blood supply through the aorta slows down. But the real danger arises when the bulging area ruptures. If this happens, it becomes a medical emergency that must be treated immediately. Otherwise, it can be fatal. Risk factors for aortic aneurysm include individuals who smoke heavily, patients with high blood pressure, elderly people, or those with connective tissue disorders such as Marfan syndrome. Such individuals have a higher risk of developing aortic aneurysm. There are 2 types of aortic aneurysm. Thoracic aortic aneurysm. It occurs when a bulge forms in the aorta in the chest region. Abdominal aortic aneurysm. It occurs when a bulge appears in the aorta in the abdominal region. The symptoms of aortic dissection are usually not evident. However, sometimes patients may experience difficulty in breathing, a feeling of fullness in the legs, difficulty in eating, and swelling in the hands and feet. If the bulge ruptures, the patient may experience dizziness, weakness, a rapid heartbeat, and severe pain in the chest or abdominal region. To diagnose an aneurysm, CT scans, MRI, or ultrasound are performed. Treatment options include surgically placing a tube graft at the bulging location, either by making an incision on the chest or abdomen and stitching the aorta, or by inserting a graft through a catheter from the groin region into the bulging area. After adding the graft, the aorta gradually returns to its original position, and the blood flow process continues smoothly.